I'm Alexis and I'll be demonstrating how to check blood sugar and how to give insulin. The first thing I'm gonna do is verify the provider's orders. He said that we need to check Miss Smith's blood sugar over here. This is Miss Smith. Miss Smith, we gotta check your blood sugar, okay? I'm gonna go ahead, wash my hands, put on my gloves. And Miss Smith, do you mind going to washing your hands for me and dry them real good? So the patient went and washed their hands and dried them for me. Okay, and then I would turn on my monitor and put my test strip in. Okay, I'm gonna go ahead and take my alcohol pad and I will check her sugar on the lateral side of her finger. Clean this in a circular motion. I'll let this dry fully. Then I'm gonna take my lancet. I will pop the side of her finger. I'll take my cotton ball, wipe off the first bit of blood. And then I'm gonna lightly squeeze her finger and get the blood on my test strip. I'm gonna hold pressure on her finger. Okay, it reads that your blood sugar is 252, Miss Smith. Okay, your finger's good. I would disinfect my machine, turn it off, take off these gloves, dispose of them, and I will document the whole procedure. And Miss Smith, your sugar is high. We're probably going to get you some insulin. I'm check your orders, okay? So after I will document this blood sugar, and I'll check her orders for insulin. Okay, so I just came back into Miss Smith's rooms after checking the provider's order. The provider is ordering 6 units of regular insulin and 6 units of NPH. I will go ahead and roll both of these and check the expiration date, and we are good. Make sure these are the right medications with the MAR. They are. Make sure this is the right patient. This is Miss Smith. Miss Smith, you know your blood sugar is 252, so I got some insulin ordered for you. Go ahead, hand hygiene, and put on my gloves. While I'm putting on my gloves, I would like to say that we like to monitor this patient for hyperglycemia since her sugar's high. So you check for frequent urination, dry mucous membranes, thirstiness. And then since we are giving insulin, I do want to make sure I monitor her for hypoglycemia. So she can be cool, clammy, sweaty, shaky. And I will make sure she's going to eat in a timely manner to make sure her sugar doesn't drop too low due to the insulin. Next, I will go ahead and check her site. So the last insulin was given in her left lower abdomen. So we're going to give it in her right lower. We're looking to see if there's any issues of why we wouldn't give it in this spot. She looks great, no issues. So I'm going to go ahead and I'm going to clean both my vials. Clean it, clean it. Okay. So I'm going to take and I'm going to draw up 16 units of air. And I will insert this into the NPH. Making sure it's not touching the solution. I will push my air in. Then I'll draw up 6 units of air to put in my regular. I will inject the air and I will draw up 6 units of insulin, making sure there's no air bubble. Take this out and now draw up my 16 units of NPH. I will draw this up. Okay. Then once I have this drawn, I will ask a second nurse to verify this. So, Miss Nurse, do you mind checking this for me? She's getting 6 units of regular insulin and 16 units of NPH per the MAR. We both check it, both verify this is the right dose, the right patient, and we are good to go. So at this point, I will go ahead and clean the patient's site. You will feel a quick little stick, and I'll try to make it not hurt too bad, but we will be giving your insulin in your abdomen today, Miss Smith. Are you okay? She verified she's okay with the procedure. We're gonna go ahead. I'm gonna pull up, pinch 2 inches of skin. So I'll inject at a 90-degree angle. I'll go ahead and I'll inject it softly. I'll try not to do it too fast. Make sure she's tolerating it well. Okay. Now pull the needle out and I will hold light pressure. Dispose of this in the biohazard bin. Make sure my patient's okay. I'll cover you back up now. Go ahead, take off my gloves, dispose of these, perform hand hygiene, and I'll document the whole procedure, document how she tolerated.